one of the most important things that I already talked about and mentioned, I'm going to go into detail here, is the inflammatory markers, especially the inflammatory markers of the blood vessel wall. And as I mentioned earlier, most people get a total cholesterol and a total LDL cholesterol. Probably an HDL, maybe triglycerides, but that does not tell us our cardiovascular risk, and that is why we run this test, because it gives us the details of a person's true cardiovascular risk. So it's going to show us inflammatory markers of the blood vessel wall. It'll show us a fatty acid balance of the omega-3 fatty acids, DHA and EPA. We know how important those are. They're present in fish, especially wild salmon, wild sardines are two of the best omega-3 fatty acid supplements. Are we taking enough? Are we absorbing them? They're very, very anti-inflammatory, so if these markers are high, if the inflammatory markers are high, a lot of times our fatty acid balance will be low. So we know we need to supplement those omega-3 fatty acids. Again, it shows us insulin resistance, levels of homocysteine in the blood, which damages the blood vessel wall, and a marker that is secreted by the left ventricle of the heart when it's weak called NT-proBNP. She talked about Hawthorne strengthening the heart. Well, if levels of NT-proBNP are high, we know we need more strengthening support for the heart. One of the most important markers is going to be small dense LDL. Most people get their total LDL cholesterol, but that is not a very good marker of your cardiovascular risk. What is important is not the total cholesterol, but it's the size of the particle. And that's what this diagram shows right here. What this is the blue is the cholesterol inside the LDL particle. And that's something that people don't realize, is that you have the LDL particle and you got the cholesterol that's carried inside of that particle. I like using the analogy, think of cars going down the highway. Well, the cars going down the highway, that is the same as the LDL particle. The passengers inside of the cars, that is like the cholesterol inside the LDL particle. Well, just like cars going down the street or going down the highway, we have these particles within our bloodstream. So what matters is how many particles there are in the bloodstream. Just like the cars going down the street, it doesn't matter how many passengers there are in the cars. That's not a danger to everybody on the road. Where the danger comes from is too many cars. The more cars we have, the more of a problem it is that they're going to run into each other. So just like the LDL particles, it doesn't matter how much cholesterol is inside that particle. What matters is how many LDL particles there are in the bloodstream. So an LDL particle number, that's something you really need to know your cardiovascular risk. And the size of that particle, because the large particles are too large to penetrate that blood vessel wall. It's the small particles that are going to cause damage by penetrating that blood vessel wall. And also, HDL cholesterol, as we know, is the good cholesterol. We want to know the amount of HDL cholesterol. We also want to know the size of the HDL particle and the strength of that particle. This is what I was talking about earlier, and this is one of the most important things on this test that's rarely ran for people for cardiovascular risk. And that is the levels of inflammation of the blood vessel wall. Three of the most important are your high sensitivity C-reactive protein, LPPLA2, and your MPO, your myeloperoxidase. Because the higher those are, the higher the atherosclerotic lesion within the blood vessel wall. The more advanced that plaque's going to be, and the higher the risk of it rupturing and causing a heart attack or stroke. So these inflammatory markers are rarely ran, but they're some of the most important. And yes, they are in the medical literature associated with cardiovascular disease risk. This test will also show us your levels of CoQ10. You know how important that is, especially if you're on a statin medication that depletes levels of CoQ10. Very important for the heart muscle. So a case I have on here is a 40-year-old male. When he saw me, he had type 2 diabetes. He had a hemoglobin A1C of 10%, and he had very high cardiovascular disease risk factors, especially that MPO was an 898. We start getting up near 1,000. That's getting to be a very, very high risk factor for a near-term heart attack. So he had very high risk factors for cardiovascular disease as well as full-blown diabetes. Overweight, his energy was a 2 out of 10. Put him on a very strict nutritional plan with botanical medicine, some of the ones Dr. Davidson was talking about, and anti-inflammatories. Curcumin was one of them she'll talk about later. But what we've seen 4 months later is we took his hemoglobin A1C from a 10% to a 6.7 just in 4 months. His fasting glucose went from a 292 to 179. And his MPO is almost cut in half. So we are reversing his type 2 diabetes as well as cutting his cardiovascular disease risk in half. He also lost 30 pounds and his energy went to an 8 out of a 10. And that is showing those markers, showing that lab side-by-side comparison.